Hey guys, Dr. Duff here with TCB Chiropractic, and today I want to talk about why growing pains is not a real diagnosis. All right, so a lot of our medical doctors, our pediatricians will consult with our patients and their kids about what's happening in their bodies as far as different pains and discomforts, commonly in the legs, commonly in the shins or knees or hips. The doctors will say it must be growing pains. Well, in my opinion, growing pains, of course, isn't a real diagnosis. It's actually not. That's a fact. But second of all, sometimes it's just our doctors not doing a full examination and not knowing exactly what the cause of the discomfort is. So when we look at growing pains in one of our patients here at TCB, it starts with a full examination. Okay, we're going to do a postural check, we're going to do orthopedic and neurological tests, and we're going to get through an exam to try and figure out what the real cause of these symptoms are. And what are growing pains? I mean, in kids, they can be anything from joint pain in the legs all the way to the spine, up through the back and the shoulders, sometimes even the neck, because as our spine develops and starts growing, it doesn't always happen on both sides at the same rate. So we might feel one side, we might feel both sides, and it's kind of confusing. Now, what are the possible causes of this? Now, of course, we know that as we grow and our growth plates start to expand the size of our bones, then that's going to happen at different rates from side to side. So some of the possible causes of growing pains are an asymmetrical development of our children, okay? And that happens normally. It takes some time and all the way up until we're fully developed to get true symmetry, but a lot of times that asymmetry can cause developmental issues, pain, discomfort as we go through our adolescence, through our teenage years, so on and so forth. So are there real solutions, or have we heard, hey, let's just rest, or let's wait and see how this develops? Well, here at TCB Chiropractic, we always are going to have a solution. If we see any asymmetries, throughout the pelvis or throughout the legs, then we're going to work on correcting those. That's going to give us a better opportunity to develop without pain and discomfort as our kids grow up. Okay, so there are solutions, and of course, it starts with an examination, and then we'll get into some of the adjustments and exercises, sometimes even traction, that we do here in the office to help with that. So there's always a solution rather than just resting or wait and see. And last but not least is the symmetry and posture. As our growth plates help us develop and grow in height, okay, they happen at different times, and that can create postural distortions. It can create lateral flexions, it can create rotations. And so these are things that can be corrected as they develop in age. And when we do that and we get it into a better position, we stress out our growth plates in an even manner, and then we can develop more optimally and more structurally sound and more symmetrical. That will help prevent these things like growing pains, which is not a real diagnosis. A lot of times there's asymmetries in the bodies that can be corrected. So if you have a kid or you know somebody who's suffering with growing pains, have them get checked by a chiropractor. Look at the symmetry of their body, a postural evaluation. All of these things will help identify what the real cause of those symptoms are, and then they can offer a solution to help with the children.